this is the final round of the competition. Let me maybe remind or introduce the people who just got here or just joined on live TV. So this is the 6 teams who have competed in the past 2 days to compete for His Majesty the King's Trophy. And the winner will walk away with $20,000 in prize money. Today, we've already done 3 teams. We have our 4th teams on the stage now. Please give a warm welcome to CMA Continuous Glucose Monitoring System from National Chiao Tung University, Taiwan. So let me remind the team, you have 30 minutes total. After 5 minutes, the judges will be allowed to ask questions. Okay. We have 3 time notifications for you. 1 at the 5 minutes to allow for the interactive session, and then 3 minutes and 1 minute before the end.
Okay.
Okay. These are the timekeepers in the front here. Okay. So everything's ready? Yeah.
Yeah.
Okay. So we start the clock as soon as you start. Right. Good luck.
Thank you. Good morning. We are CMA. This is Jimmy, our founder and CTO. My name is Catherine, the CEO, Yolia, our COO, Rita, our CMO, and Rachel, our CFO. Today, I want to tell you about our revolutionary diabetes health monitoring system. So another group today talked a little bit about diabetes. So as you guys have already heard, there are more than 422 million people suffering from diabetes. That's 1 in 11 adults. There are 3 main types of diabetes. Type 1 is the most severe and generally occurs in children and young adults. Type 2 is more common, and it develops later in life, generally due to being overweight and inactive. Finally, gestational diabetes occurs in pregnant women and generally resolves after birth. Around the world, $850 billion is spent each year on diabetes care, totaling 12% of the global healthcare costs. Just 2 countries, China and the US, account for 1/3 of that cost. Nearly 70% of spending is due to diabetes complications, and only 13% is spent directly on diabetic supplies. Complications affect every part of the body, often leading to premature death. Diabetes is the leading cause of kidney failure and puts patients at 4 times higher risk of developing heart disease. Yet, current personal monitoring devices do not provide early detection for complications. We have developed and patented a revolutionary solution, PanaPatch, multi-biomarker monitoring. The patch is worn on the arm for 14 days and measures 4 biomarkers, identified by doctors as critical measures for diabetic health. The patch automatically sends readings to the user's phone with alerts when levels are out of target range. This comprehensive data helps doctors diagnose problems early to prevent serious health complications. Our sensor uses tiny microneedles inserted just below the skin. The microneedles are hollow and allow the biomarkers to diffuse into the sensing chamber for measurement. It is held onto the skin with a waterproof adhesive and covered with a waterproof case. The patch is divided into 4 chambers. Each chamber contains an enzyme catalyst specific to the biomarker. The reaction between the enzyme and biomarker is measured by the electrodes, which is analyzed by the IC chip. The RF module sends readings to the user's phone every 5 minutes. We hold a patent for our microneedle sensor design in Europe, China, the US, and Taiwan. Our mobile app displays glucose readings over time with direction and speed of change. Other biomarkers are displayed beneath. Data is sent to CMA's cloud, which uses our patented data analysis to analyze results. Readings and alerts can be shared with doctors and family members with premium membership, and non-personal data will be shared with researchers to improve diabetes research. We have already conducted 100 preclinical trials. Our glucose readings were compared to Bayer finger prick readings and achieved 95% accuracy, which meets current FDA and ISO standards. The current glucose monitoring market is divided between finger prick meters and continuous glucose monitoring, or CGM. Current CGM devices are worn for 7 to 14 days. The CGM market will see explosive growth over the next 5 years, from 500 million to 1.5 billion in just 5 years. There are currently 3 competitors in CGM: Abbott, Dexcom, and Medtronic. Abbott uses a sensor placed on the arm and needs the reader to be placed above the sensor, so it is not truly continuous. Dexcom and Medtronic are worn on the stomach, but they require daily finger prick readings and calibration, meaning patients still have to prick their finger 2 times every day. All 3 need an additional applicator and only measure glucose. We offer 3 unique values. First, we are the only multi-biomarker system that offers early detection. Second, lower annual cost to users compared to other CGM competitors. And finally, we require no finger prick calibration or applicator, making it less painful to users and easier to use.
May I ask?
Yes.
Why it is necessary to monitor continuously throughout the day? Because the report is only like once a day. So
Right.
why is it that important?
It is most important for type 1 diabetics. So according to doctors and the research that we've done, type 1 diabetics, the most severe form, they need to measure 4 to 10 times per day. What we are offering is continuous monitoring. So one problem that type 1 diabetics have is very low glucose at night. And if you're not awake, you can't prick your finger. This is one of the 3 top acute conditions that affects type 1 diabetics under 20 years old. 70% of deaths in diabetics under 20 is due to acute conditions, including low glucose at night. So we can prevent that. We can alert them, wake them up, so that they can hurry and get medicine and get help.
I'm extremely interested in, I was very interested in reading your business plan. My 17-year-old daughter is a type 1 diabetic, so this is the sort of issue that we deal with every day. It strikes me that the main differentiator for your product is actually the fact that you don't need the calibration. Could you explain to me why your technology doesn't require calibration compared to the competitors?
Sure. Actually, can you go to the competitor slide? Great. Freestyle also does not require pre-calibration, and that doesn't require finger prick calibration. This has to do with our algorithm, and it is pre-calibrated during manufacturing. So you don't need to calibrate it every day. It's already done.
Okay, then I have another question. The fact that you don't require an applicator, I don't see as a big differentiator, because to be honest, my daughter carries around so much diabetic paraphernalia that one more extra piece of kit wouldn't bother her.
Right.
It's much more about how effective it is in terms of your needles being on the surface and going through the skin,
Right.
versus the other sensors which are actually embedded under the skin. So how, have you used this in cases where your test patients are actually very active? Is there a problem with disconnection of the sensors? Why is this just as effective as something embedded under the skin? The other question I wanted to ask is, am I correct in understanding that your transmitter is built into the patch,
Yes.
whereas the competitors, you need a separate transmitter that goes on top of the subcutaneous device?
Yes,
Okay.
that is correct. Okay, so your first question asked us about, will it stay on? Is it measuring accurately? So actually, Abbott, Dexcom, and Medtronic are also using microneedles, and it is not implanted into the skin. We're just using more microneedles into a 4-chamber array, so we can measure more biomarkers at the same time. And Abbott's patch is also approved for 14 days. According to our reviews, patients have had very few problems having it stay on. In our preclinical trials, it was done up to 72 hours, which included showering, doing your daily tasks. I don't know if it included heavy exercise, but that is something that we will definitely do during our clinical trials.
So what you're saying is that your product is just an improvement to Abbott's, correct?
Yes, an improvement to these 3 competitors.
I mean, the other 2 competitors are obviously go different route, right? So Abbott is probably one closest to your product, correct?
Not exactly. Abbott has to have the sensor placed, or the reader placed above the sensor. So they're not continuously sending you readings.
But how long will it be before they put RF chip on it?
Probably pretty soon. That's probably
So
something they could do very easily.
That disadvantage is going to go away.
Yes.
Right.
And actually, Dexcom and Medtronic are trying to be approved for longer periods of time and not have fingerprint calibration. So truly, our real differentiating value is the multi-biomarker monitoring.
So what what we've identified with Abbott is easy to just get the RFID onto the patch.
Yes.
The second one is how long will it take them to figure out that they should have more than one marker, and how long will they be able to go before you'll be able to operate before they get, you get hit by them coming into the market.
Right. Can you go to our timeline? So this product has been developed by Jimmy for over 7 years. And most of that time was not spent on the hardware, developing different chambers. It was about the algorithm and developing the accuracy that we have right now. Actually, Abbott's Freestyle does not meet the 95% accuracy within the 15% range that we have. So I think it will take them at least 2 or 3 years to develop this capability. And at that time, we will already be on our 2nd generation product.
What time? So let's just look at that.
Okay.
So 2 or 3 years, they're going to enter. They got millions of dollars.
Yes, they do
They've
have
got
millions of dollars.
resources to
Yes.
put to this.
It's
And
true.
as you say, it's a huge market. They're probably working on it aggressively. When are they going to come into that timeline with this comparable product, do you think?
I'm going to guess that it will take them at least 3 years.
What
so,
year? From when? Just show me what year.
all right, from today, let's say they go in at 2021.
Okay. And what level of market penetration do you think you can get by that year?
I have our market penetration by the last year, which we're getting much higher sales in China. In the 4th year, we have only entered 2 markets, which are Taiwan and China. During that time in China, we've actually only achieved about a 1% market share of the type 1 market. So we're not assuming that we're going to get a huge market share. We have limited resources, limited marketing, but this is a differentiated product that offers true value.
And are you claiming that the real differentiation is the algorithm, or as you said before, the fact that this measures 4 biomarkers rather than just glucose levels?
It is both. It is both. Both our algorithm that helps us measure these 4 biomarkers and the fact that we measure 4 biomarkers simultaneously.
Okay, so if I just look at the algorithm that measures glucose, are you a superior glucose algorithm, or have you just been working with the other 3 biomarkers longer and therefore you've got more experience in working on those algorithms?
No, we've been working on the glucose actually the longest, which we have a higher accuracy for the glucose compared to our other 3 biomarkers, because our patch will be registered as a glucose monitoring device according to FDA.
Okay, and then my second question is, what is actually then the value of those other 3 biomarkers? I mean, for example, if you have a very high glucose level, the ketones, you're going to immediately go get some help anyway without even
Right.
knowing whether your ketones are elevated. So what's the value of those other 3 biomarkers? Isn't the glucose level ultimately going to dictate what your action plan is?
Glucose is the key biomarker, that is true. But in researching and discussing with our physicians, all of them have said that they would like to see additional biomarkers, including ketones and lactic acid, because lactic acid can actually be elevated during exercise. So these levels could be affected by other activities, and diabetics should be watching all 4 of these at the same time. And actually, creatinine measures kidney health. And it's actually difficult to measure baseline creatinine if you're only measuring it in the doctor's office every 2 months, because it's different based on your gender, based on your weight, based on your muscle mass. So if I can tell you starting now what your base kidney function is, if there's a slight increase in your creatinine levels, then you are starting to get kidney impairment. But that may not be detected if you are just testing at the doctor's office.
On the product, may I ask, I saw the one with Abbott, right? There seems to be a device, and you
Yes.
have to kind of carry that around. For you, like, are you using like a smartphone, or how does it work? And also talk about when you say like prevention, like, is it an alert, and how does it work? And explain a little.
Okay, so we have the RF module, which is built into the patch, and this sends readings to a mobile app that we have developed in beta right now. We're still working on it, but it will give you alerts when your levels get out of your target range. So different diabetics have different ranges based on their doctor's suggestions. So you can set the levels that you want as your alerts. So my alert level is at 180 for glucose. When I start going upwards at 170, 175, I may get an initial alert saying, hey, your glucose levels are going up. If you get above 80, you'll get an additional alert. But what's even more valuable is our low glucose alert. Because during hypoglycemia, low blood glucose, if it's too low, you can actually go into a coma. And so you may not be able to wake up. But we have a low level set at 55 milligrams per deciliter. And at that level, if you don't turn off your alert, there is a function that could help you call an ambulance.
And your patent, basically, is it on the algorithms, or is it on it seems that it say like the
Design.
micro needle, right? And does it apply for like the whole world or just Taiwan?
Okay.
So algorithm also?
No, our sensor design is in Europe, China, US, and Taiwan. Our algorithm is only patented in Taiwan right now, but we will file additional patents this year. But we need further capital to do that and continue our clinical trials.
Can you elaborate on the design a little bit? Because you said competitors are also using microneedle,
Yes.
right? And what to me seems to be the only differentiator is
Design.
the communication module. That may be
Okay.
on your competitors. They are
yeah,
using a
leave
near
it here,
field
leave it
communication, but
Okay, so our competitors are only using a single needle. Our difference is that we have 20 different needles, which lets us split it into different chambers and measure the different biomarkers at the same time, which is the difference in our design, as well as the split chambers.
How well does that actually protect your product? If someone has 18 needles in a hexagon shape instead of in your shape, if they have different size chambers or more chambers or less chambers, is this really a protection against product evolution of your competitors who already have a head start in terms of distribution, if not technology?
May I add on to this also? Maybe could you elaborate more on the sales and marketing channel? Because
Okay.
you have many competitors already.
Yes.
So
Yes.
how can you penetrate?
Sales channel. So let me go first to your question about how well it's protected. Our competitors can come up with another design. They could use more needles, less needles, different chambers. It's going to take them time to come up with that accuracy. We don't think that our patent is perfect. We're not saying that Abbott and Medtronic can't do this, but we have a head start. For the sales channel, for the sales channels, we have already identified 3 pharmacies in Taiwan that are willing to carry our product, which are Great Tree, Ding Ding, and, okay, there you go, and MedFirst. And combined, they have over 500 pharmacies. We have also identified chain pharmacies in China and the US that we would like to sell to. But to enter these markets, we are looking to join with a local partner that could help us get into these sales channels faster. And one partner that we've identified is Insulet Corp, which is a US company that manufactures insulin pumps. They currently have about 10% of the market in the US. They already have sales channels established. And
Can I ask a question about this? Would you consider, I mean, because you're not just glucose.
Right.
I was just looking on the internet and I saw that Fitbit, the watch that I use, Fitbit is a device connected with an app.
Right.
They have 50 million users right now, installed base. Instead of focusing on the medical side of it, what about going to partner with someone like Fitbit or Apple Watch that are trying to add value, you know, by adding on services? Can that channel be done quickly? What's the time horizon on that, and what's your plan?
Okay. We have thought about working with Apple or Google, who are all trying to get into this glucose market. But we think that our product is very specialized for type 1 diabetics. And to get into that market, you can't just sell a glucose toy that you wear on your arm. It needs to be a medical device.
But you have to remember, there's a huge market of people, we call it the quantified self, who are interested in this type of data. I agree that not many of the 50 million are going to be type 1 diabetics, but I'm just thinking about a quick way to market.
It's possibly illegal for us to do that if we're claiming that we are measuring these biomarkers, especially for glucose. Because as a minimally invasive device, we are class 3. So I haven't researched it fully, but I think there would be a problem with regulation.
Well, it also strikes me that it's a rather, even though your costs are lower, the replacement costs are rather expensive for a casual solution, which actually brings me to the next point. Is it not true that the vast majority of people who are using your competitors' products actually get them paid for by insurance companies?
Insurance coverage.
And how do you deal with that with your product and getting into the pre-approved insurance cycle?
Yes. Okay, so for type 1 diabetics in Taiwan and the US, CGM devices that are approved by FDA can get insurance coverage. That's 100% coverage in the Taiwan market, which only has one competitor right now, Medtronic. So once we get TFDA approval, we will approach National Health Insurance and we can get insurance coverage for type 1 quickly. In the US market as well, once we have FDA approval, we will approach insurance companies to cover this. And Medicare should cover it as soon as it is approved by FDA for type 1 and severe type 2.
So based on what you are saying, if I kind of calculate correctly, Medtronic would be the market leader in Taiwan right now, correct?
Yes.
Because they are backed by the insurance company.
They are the
by the insurance policy, sorry.
Yes,
right?
yes.
And how many of the Medtronic sales are currently through your, like contact of distribution channel? You show 3 channels before, right?
They are not sold in those channels currently. They are only being sold in large hospitals in Taiwan because they are integrated with an insulin pump, which means that they will need further prescription.
I see. So basically what you need to do to make this thing pull off is a huge communication campaign to the market, because
Yes.
you are changing distribution behavior. You would need to educate people to know. Then talk to me a little bit about your marketing plan, marketing expenditure that you plan, and then I'm really question whether
Okay.
it seems to me the cost of hiring your people is more expensive than you are paying for marketing expenses. So
Yes,
that's
we
concern.
went over this yesterday. We do think that our costs, at least for marketing, are undervalued. But could you go to the, Not financial statements. Oh, that's okay. All right, that's fine. So we have extra cash flow that we could use to reinvest into marketing in these markets and increase our marketing. For our current marketing plan, first we get insurance coverage. Insurance coverage is key. Once you have insurance coverage, we go to the pharmacies, which are our direct sales, our direct customer. So if we have insurance coverage, pharmacies are much more willing to carry our product. At the same time, we use a direct sales force to contact the pharmacies and doctors with free samples. So the doctors are also going to be a key influencer, and the free samples will be relatively low cost.
And all of this is happening in China. We're not talking about the U.S.
We're not talking about
after Taiwan.
After Taiwan.
Taiwan and U.S. are almost non-existent in your
Yes.
revenue.
Yes.
All the revenue, all that you're describing, really has to happen in China.
Yes. The reason that it takes us so long to get into the U.S. market, which actually in 7 to 10 years is going to be a huge dominant revenue source for us, is FDA approval. It's going to take us at least 3 years to get FDA approval. Well, 2 to 3 years, probably more like 3 years to get it in the U.S.
So can you explain the FDA approval process in China and where you are in that process right now?
Okay. We will first apply to TFDA. So we need to do our clinical trials now. We'll start those as soon as we go back. And we need about 3,000 clinical trials, preclinical trials, which will be finished in around December. Go to the next 5 years. Once that is finished, or actually in the middle of doing that, we will apply for TFDA, which we will receive early next year. Having those clinical trials done, we can use those in our CFDA or China FDA application. And we estimate that the China FDA application will take about 1.5 years, starting from the timeline. Yeah. Next. Yes. Okay. So we will start these in 2019, and we estimate that it will be finished mid-2020, and we'll start sales in China in 2020.
And can you just given, I'm very comfortable with very, very tough FDA requirements in the U.S.
Yes.
Can you show me some example or tell me about some other product that goes through Chinese FDA as fast as you're going to go through? Is it because of the process in Taiwan and China recognizes the Taiwanese authority or the Taiwanese...
Not authority.
Yeah,
You got to be careful with that word a little bit.
I just find it a little bit doubtful that you're
Yes.
going to be so short
Yes.
of a time.
They do semi-recognize TFDA, similar to the way that Taiwan recognizes US FDA. There is a shortened process to go through Taiwan FDA once you have FDA approval. There's a similar process in China that will help us get through the FDA process a little bit faster.
Let me know about the sustainability. Would you throw it away, the patch, after use, or it can be reused again?
For hygienic purposes and accuracy, it cannot be reused. Once it is taken off, you do need to throw it away. We are working with Taiwan Plastic Development Center, which will help us use more environmentally friendly plastics, and we will also encourage users to recycle it, and it can be reused in other plastic products. But for a medical device, we can't have it reused.
And how do you achieve, versus your competitors, the cost efficiency?
Actually, our pricing is the same per patch as the Abbott. So our cost is roughly the same as Abbott. We're not having a huge cost advantage, but we are keeping our overhead costs low. Abbott is a huge company, so they spend a lot more in R&D and marketing, which will help them penetrate markets faster. But if we can keep these costs low, we can achieve a net margin, an average net margin of about 28%. And Medtronic has an average net margin of about 20%.
And,
So
and
we're-
why are you so much cheaper, though, on an annual basis than
Okay.
the Dexcom product, which is much more comparable because it's continuous and
Yes.
it's also has an app and all
Right.
the other stuff?
So first, Dexcom per patch costs $90 US. They are selling at a much higher price. They could cut the cost, but they are the market leader in the US right now for this continuous monitoring patch. So they're trying to sell at a higher price. But in this price, there's also included your daily finger prick. So you still need to pay for lancets. You still need to pay for a meter and needles, and you still need to prick 2 times a day. So that cost, which is about, I think we estimate it to be about $700 per year, is included in this. They also need 2 transmitters. So the transmitters each cost about $1,000 US. Per year they need 2, and they can use them on different patches.
So you've got less, and how do you achieve, again, that significant cost saving? Because in fact, with your product, I need lots and lots of transmitters every year because it's built into the patch itself.
Yes.
Whereas with the competitor, I buy 2 per annum and then I switch them in and out so
Right.
that I'm not overusing them. So how do you do that? How do you achieve such a significant reduction in the transmitter costs by embedding the transmitter?
So part of that comes from our manufacturing.
I'm sorry, I have to
It's-
stop you there. You have some more time
Sorry.
at the venture showcase to speak to the judges.
Right.
Okay, thank you very much, Team
Thank you.
CMA from National Chiao, Tung, Taiwan.